Your next candidate for consideration is Dr. George Phillips. Dr. Phillips is the Division Director of General Pediatrics at both Children's Mercy Kansas City and the University of Kansas Medical Center, leading 70 pediatricians in providing a medical home for 60,000 children across the Kansas City metro area. Dr. Phillips was previously at the University of Iowa, where he held several leadership positions, including a term on their Faculty Practice Plans Board of Directors. At Children's Mercy Kansas City, he is the Director of Grand Rounds and provides leadership in evidence-based practice and community benefit. A past secretary of the section on residents, which is now the section on pediatric trainees, past president of the Iowa chapter and former member of the Chapter 4 Management Committee and the Committee on Membership, Dr. Phillips currently serves on the Kansas Chapter's Committee on Public Policy and Legislation. He resides in Overland Park, Kansas, with his wife and their 3 children. Please warmly welcome Dr. George Phillips.
Good morning. It is an honor to stand before you today as a candidate for President-elect of the American Academy of Pediatrics. I'd like to start by saying thank you to our current president, Dr. Colleen Kraft, our interim CEO, Mark Del Monte, the board of directors, the National Nominating Committee, and especially the AAP staff for making this process a smooth one and one that was truly enjoyable. And to my friend, Dr. Sally Goza, thank you for sharing this experience with me, and I look forward to our working together for many years to come. And finally, to my wife, Robin, and our children, Carter, Kelsey, and Allison, thank you for the love and support that allowed me to chase this dream. The last year and a half, and even these last few weeks, have brought a whirlwind of events that at times can seem overwhelming. Now more than ever, we must maintain our Academy's focus, creating the approaches in policy and practice that advance our mission of achieving optimal health for all children. We must continue to provide the resources that promote the work of our chapters, sections, councils, and committees. We also must continue the Digital Transformation Initiative so that all of our members have easy access to the tools that make us effective advocates, particularly in speaking for children who otherwise have no voice. But our focus must also keep us moving forward. We must develop more avenues that make training in leadership and advocacy available to all of our members. And when our children and families do find their voice and a story to tell, like the amazing students from Parkland, we must have new platforms to stand with them, amplifying their stories and matching those stories with solutions that are evidence-based. Now, this is my 20th NCE, and over the years, I know the Academy has trained me well to advocate for children, but I also know that sometimes our intended audience might prefer to hear the message from additional advocates who might look a little different from me, or speak a different language, or represent some other demographic of our society. As AAP president, I will focus on increasing our diversity, not just in leadership, but across our entire membership, engaging a wider expanse of activities and interests within our organization. And just as it is important to have a diverse organization of advocates, it is critically important that our clinical care be delivered by pediatric healthcare teams that demonstrate diversity, not just amongst the pediatricians, but throughout all roles on the healthcare team. I will advance efforts to create tools that pediatricians can use to promote various healthcare careers so that we can recruit more diversity from among the patients we currently care for in order to build the healthcare teams of the future. Advocating for children and families, building diversity in our membership and our healthcare teams. And we keep seeing patients, we teach, we perform research, and then we balance those career demands with taking care of our own families. And if we're lucky, we remember to take care of ourselves. Sometimes it is that juggling act that can seem overwhelming. Burnout is far too prevalent in medicine, and pediatrics is no exception. To say that the American Academy of Pediatrics must advocate for pediatricians almost seems to run counter to our organization's history and to our Child First mission. But the AAP already does this, advocating for steps to reduce the burden of educational debt or helping us to navigate the maze of maintenance of certification. And what we are now seeing emerge, and what I pledge to continue, is a deliberate emphasis on the well-being of pediatricians. Earlier this year, the National Academy of Medicine released a conceptual model for the promotion of physician well-being. The model is centered on patient well-being, which is completely consistent with our AAP mission. And it focuses on the necessity of a therapeutic relationship between the patient and the clinician, the pediatrician, which can only be achieved when the well-being of the pediatrician is achieved and supported. With more resources like this, linking the impact of various personal and social factors on physician well-being, the AAP has a framework for exploring a variety of ways to support the well-being of pediatricians and simultaneously advancing our mission of promoting optimal health for all children. To paraphrase from the author Patrick Lencioni, I believe there are three major risks to career satisfaction: feeling that no one knows your work, feeling that your work doesn't serve a greater mission, and not knowing if your work really makes a difference. But through all of my experiences within the Academy, I've never left a meeting or a conference feeling anonymous. I'm blessed to have a wonderful network of friends and colleagues all across the country. And I know that the work we do together through the Academy serves an incredible mission of achieving optimal health and well-being for all kids. And I know that the work that we have all been fortunate to do through the Academy truly makes a difference for the children and families we serve. I promise to work every day to make the American Academy of Pediatrics an organization that speaks for and with the children and families that need us. To make the Academy an organization that better reflects the diversity we serve in our society. To make the AAP an organization that improves your well-being so that together we can continue to take care of children. And to make the American Academy of Pediatrics a place where you are known, your work matters, and you see the difference you make in this world. Thank you very much.